There are several health-related risk factors that can impact the ability for glucose in range. Lack of access to quality care is a major factor. Timely access to diabetes specialists, such as endocrinologists, who have experience using CGMs, can be challenging. It is especially difficult to find endocrinologists for those who live in underserved communities. Without access to specialists who understand the benefits of closely monitoring blood glucose, many people will have a very hard time controlling their time in range. Another key factor that can impact health is concerns about insurance coverage. It's very important to understand all the benefits of your health plan, whether the plan covers nutrition or offers diabetes education classes. Making sure to fully utilize any over-the-counter benefits or value-added benefits and knowing the process to getting approval for a CGM. Food insecurity is another health-related social need that can make it harder to increase the time in range. Not having ready access to fresh vegetables or not having enough money to even buy fresh vegetables all make it harder to maintain time in range. With housing instability, people who do not have a stable housing to properly store insulin or other medications to control their diabetes can adversely impact their health. Limited finances can make it hard to afford copays, take time off from work for appointments, or even enough funds to purchase test strips or lancets to check the blood glucose several times a day. All can contribute to poor glucose control. And lastly, transportation issues can make it difficult to keep appointments. Expanding the use of telehealth options for those who live in more rural areas or have limited access to endocrinologists can help address both access to care and transportation issues. I think one of the key challenges is understanding the importance and ensuring that our patients understand the importance of maintaining a blood glucose in range. Time in range will help lower the hemoglobin A1C and keeps the blood sugar in a consistently normal range throughout the day. Time in range can also lower the risk of complications associated with uncontrolled diabetes, such as poor circulation leading to ulcers, eye disease such as diabetic retinopathy, and advanced kidney disease. All of this information should be communicated to our patients to ensure that they understand the benefits of time in range. Good communication between patients and healthcare providers requires active listening. Patients want providers that truly understand them, that understand their situation and are there for support. And this leads to trust. And it takes time to build that trust. Communication should be patient-centered, person-centered, and empowering so people truly know how to actively participate in their own care and why frequent blood glucose monitoring is so important. Patients may be eligible if they require frequent doses of insulin throughout the day, or if they are prone to having very high or very low blood glucose levels, and if it's been difficult to control their glucose on their current insulin regimen. To be honest, eligibility and coverage for CGM can be confusing, and it depends on the insurance plan. It's very important to work with the insurance plan and with the patient and other specialists to see if CGM is right for your patient. Awareness of the benefits of CGM is spreading, so people with type 2 diabetes who are on insulin are being offered CGM. The key word is offered. Previously, continuous glucose monitors were only prescribed to the younger population with type 1 diabetes. But now the insurance coverage requirements have evolved. Medicare no longer requires documentation of at least 4 times a day finger stick checks as part of the criteria to cover CGMs. However, health equity concerns still exist. particularly around communities such as Black, Indigenous, and Latino populations. My recommendation for providers is if you have patients who have difficult to control blood sugars or who want more control over how their blood sugars stay in range, to start the conversation today about CGMs.